It feels like so much of the ideology, even if you look at the popular literature, like Robin DiAngelo, is encouraging this. Like, racism is just like a core part of your being if you're a white person. So you need to always be doing the work, always be doing, it's a never ending job of doing the work. She'll say that, and this idea that never look for solutions, always just focus on the problems. That's very much in the critical theory world, and I feel like if you've got someone who's naturally a little inclined toward OCD, this is just absolutely sabotaging their mental health, I would think.
It could certainly be fuel on the fire. OCD is a disorder where the mind tends to, it's often referred to as latches on to particular things, usually with a feared outcome associated with them in some way, whether that's a feared outcome related to the quality of one's life or the quality of one's being. And for somebody who looks at themselves as a moral agent in the world, whatever that means for them, there certainly is the possibility that they might have a propensity to have their mind latch on to something like this, where it often, if you're familiar with scrupulosity, so usually it's religious-based but morally based obsessive compulsive disorder. In that sense, you're talking about a moral basis for understanding the world, and you could certainly understand how somebody with that propensity might try to expiate, might try to find a way to go to confession in some sense, try to seek reassurance in some sense that they're not a bad person, and find a way to wash away this feeling of sin and guilt. But that process of constantly, and we see this perfectly crystallized in the academic space right now, acknowledging your privilege, naming your privilege, the negative aspects of yourself, or so the ideology puts them forth as, is these negative aspects of your experience that make you unable to understand those who are hurting, or who are in need, and you have to confess these things to the group. You have to write about it in a weekly journal entry. You have to talk about it in your presentation. One of your slides often has to be about privilege. This is kind of that expiative practice of going to, if you were a Catholic, let's say, to a priest and trying to talk about your sins, but instead of feeling better about it, you feel worse. You can feel worse afterwards. And so this process of habitual expiation takes place, expiation being the confessional. And you could certainly see some room for somebody finding themselves in that trap.